And it kind of also feels weird to say it's a surgery because
it was like a procedure, right?
Yeah, it was more like a procedure. Yeah, I think the biggest difference is like the formality or like how you speak with the patients. I feel like in Korea it's much more casual or like friendly maybe also. It's a little bit more like going to wellness center. So I thought the consultation was quite short. It was, but all the points that really focused on the post-op, and also you had like a program where you could show the patient what she really likes or what she would look like with, and it was very like casual, friendly, short, not too long, not too much pressure, just very laid back. And
it wasn't that serious.
No, it was not that serious.
It was just having a conversation with your friend.
And I also felt you spoke in Korean during the consultation. It was good and simple, so even I could understand it.
Oh.
So first of all, the time. The time, it was just 30 minutes, I think. And I kind of expected something like 1 to 2 hours. And I think also it was not very bloody. It was very clean, very aesthetic. I was just surprised also by the precision, by the small cuts.
Really? So we had less bleeding than like compared to like when we having a tooth out.
Yes.
So in the dentistry.
It was definitely funny, especially because in most surgeries there are assistants always like giving the instruments and the doctor is saying, yeah, please give me. And you basically had so less instruments that you could even take the own instrument and just use it. So yeah, I think maybe 4 instruments. So I mean, you pumped in the air, so to stretch out the tissue, but also I kind of had the feeling that you use the device, I will just call it like that, to also find the perfect angle. And I think that was, a very like smooth incision with the balloon, and kind of interesting just that it was filled with air and nothing else, and it was it felt very comfortable. I was actually really surprised because for me, obviously, or for most of the people, surgery is something very invasive, and but this was, the patient just woke up, she sat up, she wanted to move instantly, she said, I want to drink some water. So it was something I was really surprised and like positively surprised about the procedure. I do think so. I mean, I was in general always very interested in plastic surgery, and right now I was focusing more on the face. Impressed by the Motiva, so I think maybe this will be a future for also bringing that to Germany, like the expertise. Yeah, definitely, and it really did change my mind a little bit about maybe doing other parts of surgeries than just face. So maybe that will definitely change my mind into thinking, breast surgery can be very graceful and can be minimal invasive.
I try to exclude what I don't need, and I figure out what factors doesn't affect the result. Because after performing more than 5,000 cases, I came out of the conclusion that I don't need basically to wash out the internal space. So it doesn't affect any infection. So patients are my teachers as well. So I learn a lot from my patients. You know what? I always expecting to have 10-year follow-up patients. Because I want to see them in long term. Do you think people who are coming over, does it worth it to fly?
It's so easy because you just come here for maybe 1 week or 2 weeks.
Oh yeah, 1 week.
Get your breasts done and you can fly back home. Nice. It feels very welcoming. The music is really great. So I think patients will only feel very calm here and also feel like they are cared for.
See you in Germany.
Yes.
Okay. Thank you. Dankeschön.